Now we have another question by email from Wendy in Oakview, California. And she wants to know, as a single mother who meets the bills but not much more, I fall through the cracks, making too much for state assistance but not enough to afford health insurance. So what will you do for people like me?
Well, I think that is the group that I just referred to. Working people aren't getting benefits on the job, don't qualify for Medicaid. We're going to have to provide them a subsidy so that they can access health insurance. It's pretty straightforward. If you are working full-time in this economy, there's no reason why you should not be able to access health care. And one thing that I think is important is to recognize that there are a lot of small employers who would like to give health care to their workers, but they themselves can't afford it because they don't have access to large enough pools to allow them to save money. That's why I think it's going to be important for us in whatever system that we set up to make sure that in addition to the employer-based system, that we've got an alternative system that individuals who aren't getting it through the job can access. Now, I just have to repeat something I said earlier, and I am absolutely convinced of this. The most important challenge for us is to build a political consensus around the need to solve this problem. There are only a handful of options. You mentioned some of them that are out there. John Edwards has put out a plan which I think is very credible. Hillary Clinton's been working on this for a long time. I was listening to Governor Richardson. He's got some good ideas. Everybody's going to have some good ideas. The question is, are we able to bring a majority of people together around the need to solve the problem now? And one thing that makes me feel more optimistic about this than I might have been 10 or 12 years ago is the fact that business is feeling the pinch. Large corporations recognize that they can't be competitive on the international stage if their healthcare costs are rising at a constant clip and their competitors don't have to pay any health insurance because it's all covered through a government system. Small businesses know that their employees are not going to be as productive if they don't have health insurance. And so what I think is an enormous opportunity for the next president is to bring business, labor, consumers, providers together and stay focused on it for a year, 2 years, however long it takes to make sure that it happens.
Well, and one more question. We have time for one more question, and so realizing that your plan is still a work in progress, we've heard some disagreement on this stage already today about whether it is possible to do this without raising more taxes. Have you come into this with a particular perspective on this, or are you going to put taxes on the table or take them off now?
I think that we are going to have to put some money on the front end into creating a new system. And let me just take a simple example. If we're going to be serious about using medical technology to cut down on administrative costs, bureaucracy, make sure that we don't have everything signed in triplicate every time you go into a hospital. If doctors and nurses and pharmacists are communicating effectively through PDAs instead of writing, scribbling notes that nobody can read. If we do all those things, there are a lot of community hospitals out there that may not be able to afford the computerization and the software systems to set that up, and we may need to subsidize them. So we're going to have to put some money in on the front end. I think that we can, by making the system more efficient, get a lot of money out of the system and use that to help subsidize workers who don't have it and to improve the efficiency of the system. I haven't yet made a decision in terms of how much additional money is going to be needed to meet my goal of ensuring that universal health care exists in this country within 6 years. I can tell you that I will do whatever it takes because I think over the long term it's good for families, it's good for businesses, it's good for the country. So I have not foreclosed the possibility that we might need additional revenue in order to achieve my goal, but I think we shouldn't underestimate the amount of money that can be saved in the existing system. And I also think it's important to recognize that we may be putting in some front-end investments. We may have to spend several extra $1 billion on the front end as we transition to a more intelligent system. We will get those savings on the back end. Although one last point that I would make, I want to make sure that those savings go into the pockets of families and not just insurance companies or drug companies. That, I think, is very important. So one of my priorities is if we create a more efficient system, whatever the mechanism is, I want to make sure that families are seeing lower premiums, lower co-payments, and also that healthcare providers are not getting squeezed in this process of making it more efficient. I get most disturbed when I start hearing the best way to save the system is basically to cut reimbursements to hospitals, or cut reimbursements to doctors, or stop giving raises to nurses, or have nurses work 10, 12, 15 patients or 20 patients. That's not really saving the system. All that's doing is just compounding some of the errors that we've already made in the system. So, okay?
Well, thank you very
Karen,
much, Senator.
thank you so much. I appreciate it. Thank you, guys. Thank you.